CPOE results, lab and radiology, provider review. One of the most essential parts of a physician's workflow within their practice is reviewing the lab and radiology diagnostics to help care for their patients better. Within prognosis, whether these results come in manually by means of an attachment or a fax or a scan, or if it's structured data through an HL7 interface, the physician gets notified when these results are there, identified either as normal or abnormal, and then of course at an individual retest level, the physician can assign review tasks. So when it comes to reviewing your patient's results, prognosis offers two different options for the physicians. You're probably familiar with the inbox messages. As covered in our system alerts and notifications video, there's a supported event property that enables you to receive these messages in your inbox that has an attachment to the result. That allows you to review your results individually. We also now have the new automated work list. Now the work list is associated only to a provider's logon, and you will see this by means of these new notification bubbles in the upper right hand side of the screen next to the welcome doctor. These notification bubbles are color coded. Blue would indicate lab results and the maroon indicates radiology results, and the numeral that you see within the bubble represents the number of unread alerts that the physician has not yet reviewed. So this is a quick way to immediately look at new alerts that have just now come in. There's also a menu option through the CPOE menu dropdown where we've provided the lab review and radiology review screens as well. Now that will include new ones that you've looked at as well as previous ones that you have not yet completed. So we're going to look at both of these options. I'm going to toggle into the application now where I'm logged in as Dr. Shelton Cooper, and we see here in the upper right to the right of the welcome Dr. Cooper we have a navy blue bubble that has a number 6, and then we have our maroon colored bubble with a number 3. The navy blue represents your pending lab results that have not yet been read, and the maroon represents the radiology. And if I quickly just show you here under the CPOE drop-down menu, we also have sub-menu choices, lab review and radiology review. Now many of you are already familiar with the Zoom icon within your mailbox. The prognosis inbox gives you a supported event when a result has been posted, and then when you click on the magnifying glass it takes you to that result. But then you have to come back into the inbox and open up the next message. This new review option allows you to open up a screen that has only the results. For instance, I'm going to click on my lab review notification bubble. And you'll see here on the left-hand side the 6 that I have not yet read. And by default, you'll notice that each of them is represented by a red radio button. That red color indicates it has not yet been selected or reviewed. Now, if I select it, for instance, I'm going to go ahead and select Charles Reed here in the middle. That takes me directly to that result. So this would be the equivalent of clicking on the Zoom icon with the supported event alert in our inbox. It's defaulting to my result tab, in this case of Charles, because it was a structured data result. Now notice if I choose another one such as Olivia Pope, Charles Reed now displays in that pale green color, and Olivia is the one showing in blue as the one I've selected. And this is how it will work. As I go up and down, you'll see the green indicates that that particular result has been read. The blue color indicates the result I'm actively reviewing. On the right-hand side, I have my mark as reviewed. So if I am looking at it in this singular screen without having to go back and forth, I can go ahead and mark it as reviewed. If I would like to enter comments, I can expand or collapse my text field and add in my comments as appropriate. I've also got the ability here of assigning a task. This, of course, calls on the standard mail action codes that are defined under your group types under Settings Configuration. You can decide who you want to send the message to, whether it is going to be the default medical assistant who was already assigned to attend your patients. You can click the Zoom icon here to bring up a list of all of your other employees in the practice, as well as distribution mailing lists, depending on what your workflows are. And just as we have in our composed message, you have the ability of assigning this to the patient's medical record, so you have a record of it. And then once you go ahead and save the review, notice now in the upper right, my blue bubble has changed to a lighter blue and now has a 0, indicating that I have no pending unread results because I just reviewed all of them at once. I still have my radiology results, however, in the maroon bubble. Now with radiology, since it's not typically structured data, when you select your radiology result to review, it is going to open immediately to the attachment by default, so you can look at the scan. So it gives you the same functionality that we had on the lab result, but in the lab result, since we had the numeric structured data, it opened to the results tab. In the case of radiology, since there is going to be an attachment, whether it's the diagnostic report or the image itself, that will be the default view. So the design or the intent of this function is to make it easier for the physician to do his review on a singular screen without having to go back and forth, and then to have all of those pending results right here in one window. And the alert bubbles will give you a real-time countdown as these results are being reviewed. And over here on the right, just as we saw with the lab result review, when we're reviewing the radiology, we can expand or collapse the review area to indicate our remarks. We can assign a task to our nurse or our medical assistant if needed, as well as add our review remarks to the patient's medical record. And since we have flagged this as reviewed, if you notice over here on the left, our red radio button now shows a green check mark, indicating not only have we read it, but we have also reviewed it. Now the next thing I want to show you is if we go to the CPOE tab and we choose our lab or radiology review menu, as opposed to going through the notification bubbles, it's the same user interface with one difference. If we notice here on the left-hand side now, we see a lot more names listed. This is now going to show us every result, whether we have previously read it or not, that has not been reviewed. Once a result has been reviewed by the doctor, it will no longer show here and will only be available on the patient's document list or under their chart review. But unlike the notification bubbles that show us only unread alerts, the menu option itself will include read as well as unread, anything that has not yet been reviewed. And here we have additional access as we do on the results screen. You'll notice that we have our patient contact info. That, of course, is a customized template. If our test is affiliated with our health maintenance, we can go ahead and interface it over to our face sheet health maintenance review. And if we would like to look at the test results in a matrix view to see how it has fluctuated over time, we have that icon as well. So in review, for CPOE results, provider review, we learned that this is applicable to both lab and radiology results. The new work list option lets physicians review all their new alerts in one screen rather than individually. Notification bubbles provide direct link along with a counter of the new unread alerts. These are unique to a provider's login only, and the number will count down as the physician reviews his results. In addition, there is a CPOE menu drop-down which includes all non-reviewed lab and radiology results, regardless if they have been read yet or not. All results, once reviewed, are only applicable under the patient's chart. For non-doctor roles, read-only access can be given under the role definition. That concludes this video within the series. Please click the appropriate link below for your next step. If you'd like to take a quiz, you will receive your results in real time directly on the screen so that you can see how well you've done. If you answer incorrectly, the system will prompt you with the correct response. In addition, a confidential email will be sent to the education team to help us better serve you with our educational offerings. Second, advance to the next video within the series you're currently in. And finally, return to the video library main page. As always, feel free to contact us through the Resource Center or email with any additional questions or comments.